So, Edwin, on Sunday we were talking, and one of the prevalent things that came up was that there is a sort of split between criminalisation and public health models for managing people who are HIV positive. And you've been really influential in trying to shift things from a criminalised mode to a public health model. How successful have you been so far?
Well, I think I want to clarify that the model that I propose isn't public health law or the model that you're using in Australia necessarily, but an approach that recognises that caring about the public health in general and supporting, testing and treatment and all of the HIV prevention work that already happens in order, to prevent new infections.
Yeah.
That's the real alternative to the use of the criminal law. Now, in Australia, because you've got this public health model that's already in place and appears to be preventing many more people being prosecuted, I can see why the organisations in Australia support it as an alternative model. But I'm not necessarily in support of bringing in the same model in countries around the world. The idea really is to ensure that if anyone is using the criminal law, and we would prefer that they didn't for anything other than malicious intentional transmission, of which there are very, very few cases in the world ever, to basically not use the criminal law, but to use the public health system, so nurses and doctors and also the HIV organisations that work in HIV prevention. So more generally, in supporting people with HIV, including for all their needs, whether it's mental health needs, sexual health needs, and understanding that actually HIV prevention isn't just the onus of the person with HIV who knows their status, but it is a shared responsibility. And that's what I talk about the public health message, is that each individual is actually responsible for their own sexual health.
Yeah, because at least what I'm familiar with in Queensland, it's very easy for the public health model to be the criminal model by proxy.
Absolutely.
And I think there are risks that with it as well as with the criminal health thing. And sure, it's certainly better to move away from prosecutions. One of the things that I know that we really need in Queensland is a really clear willingness to embrace undetectability as being now off limits for criminal scrutiny. Mm-hmm. And we're not getting that. We're not getting a statement about that from anyone, from public health at all. One of the real issues with public health is how secretive it is, and you don't know that it's happening until it's happening badly to you. Mm-hmm. What do you think agencies should be telling us about undetectability and culpability for?
Well, there's a real tension between what we know about the impact of treatment on an individual's infectiousness and how it's being used both in the criminal justice system, but also how the fear of knowledge of that by public health authorities is actually limiting that information by them. So basically, public health authorities are concerned that if everybody knew or believed that if someone who was on treatment who had a low or undetectable viral load was very unlikely to transmit HIV, it might create what they call risk compensation, a sort of a false sense of security. Yeah. And one of the real problems is that the people who are most infectious are people who are recently infected and don't know it. And if there's a sense that if there's a sort of a belief that everybody who knows they have HIV can't be infectious because they're on treatment, which doesn't really match the reality that actually a small percentage of people who are newly infected actually are the most infectious and of course aren't on treatment and aren't infectious. the public health authorities are concerned that it's sort of amongst the community,
Right.
there might be fewer people using condoms.
Yeah.
However, within a criminal justice approach, it's on an individual case level. It's very important that the law understands that someone who's on treatment and has a low, it doesn't even have to be an undetectable viral load, it just needs to be a low viral load. The study, the TPN052 study, which found the 96% reduction in risk, wasn't about undetectable viral load. It was about somebody who was on treatment for more than a few months. And so it's just about being on treatment and having your viral load to very low levels. It doesn't have to be undetectable. Then there is not a significant enough risk for anyone to be prosecuted. But there is this tension in terms of how that information is conveyed.
Right.
So, for example, the Canadians, they've produced a consensus statement. More than 70 Canadian scientific experts have produced a statement specifically about the impact of treatment on infectiousness. But they've made it clear that this isn't a statement aimed at HIV prevention. It's aimed specifically at the criminal justice system, so that there are no miscarriages of justice around prosecutions for people who have allegedly put people at risk, but in fact they haven't. They couldn't have done because they were on treatment.
How successful have you found this conference in broadening the view about criminalisation or the?
Well, I mean, we're only halfway through the conference, so it's hard to say. But my sense is that this is the first time that sort of broader human rights and criminalisation issues, across the board. So not just the criminalisation of exposure, of non-disclosure and transmission, but also of sex work, of people who use drugs, of homosexuality. All of those things seem to be highlighted more than ever before, and it probably helps that Justice Michael Kirby, who was in the opening session and also was at our criminalisation pre-conference, has been highlighting that work, and a lot of people in the community have been pushing for a recognition of the importance of human rights and advocating against punitive laws and policies in general as an important, if not the most important, response to HIV alongside the science. So I think in that respect, the conference is successful in ensuring that at least the people who are attending understand the importance around these issues. But really, a conference is just about an exchange of ideas and knowledge. What's really important is what happens after the conference.
I guess from my point of view, the thing that has stood out is, I think Paul Kidd has been seriously good and very successful in getting 19A into a position where it's being reviewed. I suppose if I have any doubts, it's just around whether the public health model can be very vague, and you never know who's working with what, and I've lost my train of thought, actually. So,
well, no, but I think I know the question you were going to ask, and what I wanted to say was that over the years that I've worked on this issue, I've moved from a position of being, incredibly radical and impatient, that actually it's important that we just get rid of all the laws and get rid of any way that people who are living with HIV are controlled or punished for our behavior. Of course, that's the ideal world. That's what we all want. The reality is that we have to be pragmatic, and we have to suggest things to the people who are in power in a way that is palatable to them. And so, what Paul Kidd and the other people on the legal working group and the other organizations are trying to do, and it's a fine line, is basically sell the idea that for now, there is a system in place, the public health system, as an alternative to the use of the criminal law. But that is not necessarily what everybody wants is the end game.
Okay.
What I think what everybody really wants is that the state doesn't play a role in interfering in our private lives, including our sex lives. I mean, that's a very libertarian point of view, but in fact, I don't think the state has a role in punishing or controlling people with HIV above and beyond people without HIV or any other disease, and especially those of us who are on treatment or those of us who are using condoms. So I think the key thing is to remember that victories are won in small increments, So
in a sense, that means the step in Queensland, then, from my point of view, would be that the public health system needs the management around HIV needs to be disconnected from its legal basis, that it carries a threat.
Absolutely.
Because it seems relatively benign on paper. It seems like an ideal situation. In fact, most countries in the world would, I think what we've got is an ideal situation. But the way we're managed is actually underwritten by some seriously threatening laws, which I think are ultimately being counterproductive.
That's right. I agree. Cut the cord. Basically, a public health approach which is about supporting people who are in need of support to live happier, healthier lives, including having happier, healthier sex lives, that's great. But remove that threat of the ultimate punitive approach, which is if you don't do these things, then you will end up being prosecuted, or we'll just isolate you in prison or in a hospital for a while. I think that's the problem. I think the whole point of a good public health approach, of course, is a person-centered approach to make sure that those of us living with HIV are happy and healthy and well, and our partners and our communities. And I think the most important thing is to see them as allies and not as agents of law enforcement. I don't think public health people want to be agents of law enforcement. So the question is, how do we improve the public health response by making sure that they can support us? But I think the advocacy now needs to be to make sure that the laws that are underwriting the public health response are changed or removed or revised so that there isn't that threat, that it's about supporting, not punishing people.
Okay. We got it.
Okay, great. Good.